Hello, I'm Dr. Janie Bailing, and I would like to explain what cognitive processing therapy is. I decided to make a video for my patients before I get ready to start the treatment. I'd like them to be able to understand what exactly is going on with it, and even to start thinking about their own experience before we actually start the therapy. In the beginning of the therapy, I will go over, actually what's going on in the brain and the body, the brain mind body connection. But beforehand, I want my patients to be able to just start thinking about their own experience and how that could fit into the therapy model, and how you could see the therapy model working. So cognitive processing therapy, it's an evidence-based practice. That means it has been tested on, thousands of treatment samples, and we've been able to see that it's been effective. It's specifically for PTSD. However, I have actually used parts of it in other types of therapy where I'm trying to help people what we call restructuring thinking processes. It's a very effective approach to literally change thought processes that will lead to just more peaceful emotions and more peaceful outlook onto life, being able to not immediately go to this very negative stuck thought, a stuck place, but be able to look at things in, just from different angles, just to be able to do that quicker. With PTSD, we find that the main gist of it is when we have gone through an event that has been life-threatening to ourselves, or to a child or a loved one, we do a very natural and what I think of as a perfect thing, and we immediately figure out what we need to believe about that situation to prevent it from ever happening again. We have to believe something to keep us safe in the future, and that will actually store itself in our in our body, in different sensory places. And cognitive processing therapy doesn't go to the sensory areas like another treatment model like EMDR could, but it actually goes to the thought process that is also part of that whole chain reaction around that event. And what's understood is that if we start dealing with the thought process, that then affects the emotion, which then affects the behavior that's in response to the emotion. And we also think about the emotions as just, it's kind of like a little button in our brain. Like if I have the emotion of anger, that's a little button in my brain that engages all the neurochemicals and our system hormones to deal with anger, to kind of even encourage this aggression, to be able to manage that situation in an aggressive way. Same with sadness. If there's the sad button, what I like to think of it as, that is about proximity and calling people close to connect in some way. It was like one of the first emotions we expressed as humans when we were born was sadness, so we could elicit our caregivers to come to us and take care of us, or feed us, hold us close, keep us safe. It's a very primitive response. Well, we don't outgrow that. And so when we're adults and we're sad, we're doing the same thing. We're needing to connect with people. We're calling out to get close with people. And with that emotion comes a behavior to make that, to meet that emotional need. And with cognitive processing therapy, CPT, we're not looking at the behavior and we're not looking at the emotion, but we're looking at the first thought that started the chain event. And we're identifying all of those things, but at first we're dealing with that belief, that first belief. And that's a game changer, and that is why it has actually been so effective, is because CPT is so effective at looking at that thought, that belief, and helping reconstruct it to lead to a more peaceful and centered way of approaching a situation. So my patients, and whomever is going to benefit from this, anyone that's getting ready to go into CPT with their therapist, I hope this is helpful. But to my patients directly, as I'm talking to you about these things, and we're going to go into this in more detail at our first session, we're going to call it psychoeducation, which is in the very first session of the CPT protocol. But I would like to use this video for you to start thinking about your trauma. What are the beliefs that you're noticing? And we'll get into this, but just this is like to kind of prime the pump. What are you noticing that you believe about yourself, the world, your future, and some of those very fast thoughts in those moments? This is just to kind of start that conversation. So I hope you took notes. I instructed you to take notes before you watch this video, but just your own notes, because you're going to bring those back to session. But just to start thinking. And then if this is helpful for others who are going to be using this with their therapists, take notes. Take notes for questions to then bring into your therapist, so that they know it kind of exactly as well as possible of any apprehensions you have, any curiosity. How could this help me? There was an event I forgot to tell you. There's an event I didn't want to tell you, but I think that has to do with some of the stuff I just heard in this video. Just use this. I encourage you, and I'm hoping this helps. So anyways, for my patients, I'm excited to start this with you.